mentioned, I'm Veronica Segovia Bedon, Senior Advisor with AARP's Multicultural Leadership Team. I'm really excited about the partnership with LACLA this year, and this evening I'm here to share what AARP is doing to support our family caregivers during this COVID-19 pandemic. We've been working tirelessly at AARP, directly with the government and state officials to make sure that you and the ones you love and are taken care of with needed resources that we have available. This is a stressful time for all of us, but especially Latinos. Latinos across the country are among the nation's leading population living in multi-generational homes, which means that makes a lot of us mostly impacted by this pandemic. And many of us, due to the nature of the work that we do, are not able to stay home. And that requires extra steps to stay safe for yourselves, your children, and primarily older relatives who are at greater risk. It's why AARP puts a strong focus on allocating resources to aid our family caregivers during this challenging time. I'm sure that I share the same sentiment with all of you who are on this webinar tonight, that each of us needs to check in on our relatives during this time. And now it's a time to rely on each other, not just for physical support, but also emotional and mental support. And that ties heavily into our focus for caregiving during the COVID-19 pandemic. With more than 50 million family caregivers already helping loved ones in the US, AARP knows that this virus will be affecting mothers, fathers, abuelitos, amistades across the nation. And this will lead to more responsibility for existing caregivers and will create a whole new set of people who are caregiving or find themselves in the role of a caregiver that they didn't before. So as caregivers, whether we're experienced or new to the role, we can stay prepared and plan ahead. We may not always identify or recognize that we are ourselves caregivers, but if you find yourself helping a family member with everyday tasks, picking up prescriptions, maybe you're helping a neighbor with something like groceries, you are carrying out duties of a caregiver. First conducted in 1997, the National Alliance for Caregiving and AARP have done the Caregiving in the US report. It's an update that presents the portrait of unpaid family caregivers. Family and friends comprise the most basic unit of any society. And for individuals who take on the responsibility of caring for another person through sickness or disability, it can often be challenging to see beyond our individual experience. As individuals, families, and communities continue to confront this novel coronavirus or COVID-19, we're reminded how much we need our family and close friends to keep us going. So as the US continues to address this unprecedented situation, the need to recognize and support family caregivers as the cornerstone of society will only become more important. Today, more than 1 in 5 Americans, or 21%, are caregivers, having provided care to an adult or child with special needs at some time in the last year. This totals an estimated 53 million adults in the United States. This is up from 43 million in 2015. So in just 5 years, we've had more than 10 million more adults taking care of others in the United States. These are some recent stats of the most recent report that came out last week. Caregiving in the US has found that caregivers face health challenges of their own. So nearly a quarter of caregivers find themselves having to take care of their own health, and 23% say caregiving has made their own health worse. Personal finances are a concern for family caregivers. 28% have had to stop saving. 23% find themselves in more debt, and 22% have used up personal short-term savings to cover the costs of caregiving. And on average, caregivers spend 23.7 hours a week providing that care, with 1 in 3 working for 21 hours or more a week. 1 in 5 is providing care for over 40 hours a week, so the equivalent of a full-time unpaid job. There are 5 main steps that you can take to provide the care for your loved ones and to have peace of mind along the way. The first step is to pull together a team. So what you want to do is gather that list of individuals in your family or friend network that can be allies to you during this time, and source the key services in your community that can be of aid. The second step that AARP recommends is to take inventory of essential items. So calculate how much food, medication, and basic supplies the person you are caring for has on hand. And we recommend having a 2-week supply of essentials, including food, water, cleaning products, and medical supplies. The third step is making sure that you have your medications or the person who you're caring for's medications in order, and see if you're able to get extra from your pharmacist. Talk to your medical provider about that. It's vital to ensure that you have the list of medications for the person you're taking care of, the correct medical contacts up to date, and any health-related information handy. And AARP recommends having an extra 30-day supply of essential medications on hand. The fourth step that AARP recommends is to create a plan to stay connected. If your loved one lives away from you or is in a nursing home, we encourage you to set up communication lines via the internet with a FaceTime video, Skype, whether that's, working with someone in your family who might be able to help you do that if you're not as technology savvy. WhatsApp video is also helpful with family, or simply an ability to call, get in touch with someone over the phone, or text. The final step that AARP recommends is to maintain your own personal safety and self-care as a caregiver. It's really important. Taking care of your loved ones begins with taking care of yourself. It's crucial right now to limit contact with visitors, stay home as much as possible, and continue to follow CDC guidelines. With these 5 steps, AARP hopes that caregivers will be able to lay the groundwork for staying prepared to care. So some other tips are definitely to remember that those who are over the age of 60 are at higher risk. So if we have someone in our home who is over the age of 60, we want to be very careful and take extra precaution. It's also really important that you don't forget about yourself. Take some steps. You can't take care of other people unless you're taking care of yourself. And I know that's really hard to do. And I share that struggle myself in remembering that I have to take care of myself so that I can take care of the others in my family. So with that, I'd like to show a video. Someone is going to help me do that right now on the subject of nursing homes. It's a video that AARP has put together and that we have out to help those of us who might have someone in an assisted living or in a nursing home right now.
Hola, soy Bel Peña, experta en cuidado familiar para AARP. Si tienes seres queridos que viven en un hogar de ancianos, centro de vida asistida u otra instalación de cuidados a largo plazo, sabemos que quieres información para protegerlos durante el brote de coronavirus. AARP consultó con expertos y elaboró una lista de 6 preguntas clave que debes plantear en las instalaciones de cuidado para abogar para la seguridad de tu ser querido. ¿Alguna persona en el hogar de ancianos ha dado positivo a la prueba de COVID-19? Los centros de servicios de Medicare y Medicaid exigen que los hogares de ancianos informen a los residentes y a sus familias si alguien en las instalaciones dio positivo al virus. ¿Qué medidas se toman en las instalaciones de cuidados a largo plazo para prevenir infecciones de coronavirus? ¿Se examina a las personas cuando vuelven a entrar al edificio? De ser así, ¿cómo y qué precauciones se toman para los residentes que no tienen una habitación privada? Los trabajadores tienen el equipo de protección personal que necesitan, como mascarillas, batas y guantes para protegerse a sí mismos y a los residentes. De no ser así, ¿cómo planean obtenerlos y capacitar al personal? ¿De qué manera las instalaciones ayudan a los residentes a mantenerse en comunicación con sus seres queridos? ¿El personal ayudará a los residentes a realizar llamadas o videollamadas para comunicarse con sus familias regularmente? ¿De qué manera las instalaciones mantendrán a los residentes y familiares al día en cuanto a información importante? ¿El personal va a llamar, enviar mensajes de texto, correos electrónicos o actualizaciones por correo postal? De ser así, ¿cuándo y qué tan a menudo? Y por último, ¿el centro de cuidados a largo plazo tiene un personal completo de enfermería, auxiliares y otros trabajadores? ¿Hay suficiente personal para asegurar que se atiendan las necesidades de los residentes como ayuda en el baño, la alimentación y administración de medicamentos y las actividades físicas? AARP te anima a investigar esta información e insistir hasta que consigas las respuestas que necesitas. Si todavía estás preocupado, comunícate con la Oficina de Defensor de los Cuidados a Largo Plazo en tu estado. Y recuerda también cuidar de ti mismo en esos momentos estresantes.
Thank you. So, as you saw in this video, AARP has developed a few key questions that those of us who have someone in a nursing home and who we are concerned about their care during this time that we can ask to ensure the safety of this loved one. This video is also available in English, and if you found it useful and would like to share it with your networks or someone you know, you can go to AARP or AARP en Español on Facebook to share it. I'm also happy to share it with my friends at LACLA so that I can give it to those of you who are tuned into this webinar right now. And I'll go over those 6 questions in English now, since we got to watch them in Spanish. But the first question that AARP recommends asking is, has anyone in the nursing home tested positive for COVID-19? This includes residents of the nursing home, includes staff, and any visiting vendors. You want to ask if anyone in the facility has tested positive. The second question is, what is the nursing home doing right now to prevent infections? It's important to understand how the nursing home staff is being screened for the virus, especially as they come and go from their homes into the facility. It's also vital to understand what precautions are being taken for the residents who aren't in private rooms. If there's a resident who is in a shared room, what are the extra precautions being taken for them? A third question that we recommend asking is, does the nursing home staff have and are they trained to use personal protective equipment, otherwise referred to as PPE, things like masks, face shields, gowns, gloves, etc., that they need to keep themselves and the patients safe? The fourth question that we ask or want you to ask is, what is the nursing home doing to help residents stay connected with their families and loved ones during this time? So as I mentioned, that notion of that ability to be able to stay social and connected with our families and our loved ones at this time is especially important for helping our mental health, for helping us feel and stay together during this time, even though we may be at a distance and apart. So what is the nursing home doing to help you stay connected? Are they helping residents use a phone or video chat? Are they able to put together a schedule? Is there a set schedule that you need to put yourself on? How do you make an appointment to do that, to make sure that you can speak with your loved one? The fifth question that we recommend is there a plan for the nursing home to communicate important information to both residents and families on a regular basis? And how will they be contacting you? Is this by phone, by email? Let them know what you prefer and what works best for you so that you can stay in communication with your loved one and with the facility so that you can stay updated. Lastly, AARP advises asking, is the nursing home currently at full staffing levels of nurses, aides, and other workers? This is important to understand. If the home has a staffing shortage, what is the home's plan to make sure that the needs of the residents are met at this time? So depending on the answers that you receive to these questions, you might ask yourself whether you should take your loved one out of the nursing home during this time. The reality is that there is no one-size-fits-all answer. It will depend on the situation that you have in front of you. Whether someone should stay in a nursing home or move into the home of yourself or another family member during this time really depends on a few things. One, it depends on the condition of the individual and the type of care that they need. Two, the level of support that the family can provide. If you're thinking about bringing that person into your own home, what is the level of support that you can provide realistically at this time? And how is the facility handling the virus? So those are the three things that AARP recommends you consider before deciding to make a move. The condition of the individual and the type of care they require, the level of support that you or the family member who you're planning to move them to can provide, and how the facility itself is handling the virus. Before considering a move, AARP highly recommends that families consult with their loved ones' medical providers for expert advice. A few things to keep in mind if you're considering a move. Some care facilities may offer medical services beyond what can be provided at home. It's also important to note that eligibility for Medicaid and Medicare may change if an individual is removed from a nursing home. And the rules vary from state to state. And some individuals may no longer qualify for Medicaid or even be permitted to return to the nursing home in the future. So all considerations that we want you to keep in mind. So please do consider each of the challenges that may arise should you decide that it's best to move your loved one out of the nursing home. I want you all to know that AARP is calling upon nursing homes to be transparent and open with residents, families, staff, and the public about how they're combating COVID-19 by calling on state officials to share information with the public, asking Congress to support virtual visitations, and more. Please know that AARP is advocating for you, your loved ones, and will continue to do so. At AARP, we understand that caring for a loved one, whether you're together or apart right now, and is really important. And we hope that these tips will provide some guidance and comfort to get you through it. AARP is fighting to protect vulnerable seniors in nursing homes, assisted living, and other long-term care facilities from sickness, neglect, and isolation during COVID-19. Here are some ways how. Through family communication. So we're asking nursing homes, assisted living, and long-term care facilities to have a plan in place for family members to regularly communicate about the status of their loved ones and the facility. PPE, like I mentioned, all nursing homes. We're asking all nursing homes, assisted living, and long-term care facilities to have systems in place to prevent infections during the pandemic, including supplying PPE, adequate PPE like masks, face shields, gloves, and gowns to all their staff. We're also asking nursing homes, assisted living facilities, and long-term care facilities to immediately report any residents and staff infected with COVID-19 to health officials, residents, families, and the public. Transparency in these facilities is paramount to making informed decisions about a loved one during this pandemic. As I mentioned, we're also asking long-term facilities, assisted living facilities, and nursing homes to have plans in place to provide ongoing, uninterrupted care for residents when it comes to the assistance they count on daily. So that means, is there enough staff to adequately care for your loved one and help them with the assistance that they need every day, whether that's with bathing and dressing, getting out of bed, going to the bathroom, meals, feeding, taking their medicine, and more. AARP is also advocating for testing. We're asking states to prioritize access for testing for persons living and working in nursing homes, assisted living, and long-term care facilities. We're also asking and working with teams to look at transfers and discharges. So vulnerable residents, making sure that they have the right to return to their nursing home, assisted living, or long-term care residence after a hospitalization or leaving the facility for a short period. Nursing homes, assisted living, and long-term care facilities should have a plan in place to make this possible. And additionally, there should be no involuntary discharge or transfers from nursing homes, assisted living, or other long-term care facilities during the coronavirus emergency, except as necessary under CMS guidance. And virtual visitation. All nursing homes, assisted living, and long-term care facilities should have a system so that we can stay connected to seniors and keep them connected with loved ones virtually on a regular basis, whether that's over the phone or video chat options or communication, including FaceTime, Skype, or maybe Zoom. This map is an example of the work that AARP is doing across the United States when it comes to advocacy related to fighting for nursing homes residents and their families. In certain states, there may be additional actions to support seniors in nursing homes, assisted living, or long-term care facilities. In New Hampshire, for example, residents of nursing homes, assisted living, and other long-term care facilities should have access to their ombudsman program. In New Jersey, in the event of a family member that's inappropriately denied visitation, states should ensure that there is a hotline established for families to seek assistance and resolution. And in the state of Washington, we're asking for increased federal medical assistant percentages, rates from the CARES Act for long-term care, which should apply to long-term care facilities. I invite you guys to join AARP and to follow AARP advocates and Aliados Adelante on Facebook or other social channels to share the advocacy-related messages with your networks. So as I mentioned, aarp.org/caregiving, if you click on nursing homes, you can take action right there. aarp.org/caregiving and click on nursing homes. You can also do it in Spanish at aarp.org/cuidar. That's where you can click to take action and send a letter to your representative in Congress. You can also join the conversation on social media by following AARP Advocates and AARP Aliados Adelante on Facebook. We are really counting on support from people like you to speak up for nursing home patients during the pandemic. Also, nursing homes continue to be a hotbed for the coronavirus infection, with already 20,000 deaths as a result of COVID-19. Our leaders must act immediately to stem the loss of life and improve conditions in America's long-term care facilities. Tell Congress to take immediate action to protect nursing home residents, staff, and their loved ones from this disease. I want to take this opportunity to share resources with you. Some that I mentioned, aarp.org/caregiving and aarp.org/cuidar. This is where you can find our Prepare to Care guide. So the 5 steps that I shared with you on how to stay prepared to be as a caregiver. We have free Prepare to Care guides in English and in Spanish on these websites. We also have additional information related to coronavirus. So you can go to aarp.org/coronavirus or aarp.org/el coronavirus in Spanish to get information. There's a handy tool there. There's a handy tool on either one of those websites. If you scroll down, you can see coronavirus and coronavirus E, and you can see many different lists of topics related to coronavirus where you can learn more about unemployment, where you can learn more about caregiving, you can learn more about Social Security, you can learn about many different topics that are affected right now by the coronavirus. We also have AARP communityconnections.org and aarp.org/micomunidad. This is where you can find mutual aid groups in your area made up of volunteers who are helping those in need. This stems from whether it's from a need for picking up groceries for someone to lending emotional care to neighbors. You can find out more there on what people are doing to help each other at aarpcommunityconnections.org or aarp.org/micomunidad. A great feature of Community Connections is a friendly voice, which allows users to ask AARP volunteers to call and check in on loved ones. Our toll-free number for that is 1-888-281-0145. And it's also available in Spanish, La Voz Amiga at 888-497-4108. I believe these slides will be shared with you. So I'm going to go ahead and just share with you that these are just a few of the resources available at AARP during this challenging time. And I invite you to find out even more information that might be valuable to you or your family on our website. Look after each other. Let's be allies for one another in our community. Let's be allies for our neighbors, our family, and our friends. And remember that we're all in this together. Y que juntos es posible. So I will hand it off now to our next speaker. Thank you.
Mil gracias, Veronica. Thank you, Veronica. Those were guidelines are great. It's great information that you presented to us, especially when you mentioned that it's in Spanish. One of the issues sometimes it is that our people really need that information in Spanish. So thanks a million de gracias to AARP for actually doing that. So we now going to our next presenter, Tania Cornejo. Tania, the room is yours.
Okay, thank you very much. Welcome everyone, and thank you for having me. So I'm just gonna share my screen so that you can follow along with the topics that I'm going to cover. So protecting yourself and others from COVID-19 is what we'll be talking about. As we all know, COVID-19 is an illness that is spread from person to person. It's a new coronavirus that has spread throughout the world, and symptoms can range from mild to severe illness, and sometimes people can even exhibit no symptoms. That is the most critical part of this disease because some people don't even know that they have COVID-19. because they don't have symptoms, they're the ones who can more easily spread it to those who are not sick or vulnerable to the virus. So it's primarily spread from person to person by coming into close contact with a person who has the virus. And it's through respiratory droplets when an infected person coughs, sneezes, or talks. And also you can contract the virus by touching any surface or object that has a virus on it, and then touch your mouth, nose, or eyes. And I just want to ask, we'll just have a little fun with this, since I am not able to see everyone, but at least raise your hands, even if it's just for fun, and who washed their hands before they came onto the computer. Okay, great. Thank you, panelists. You're the ones that I can see. So, you know, we're not always the best at doing that. Nurses are notorious for being a little more rigid as far as washing hands. But now with the COVID-19 being in our communities, we have become hyper aware of how important it is really to wash your hands. And protecting yourself starts with staying at home. Really, it's not said enough. I'm sure you've heard it on social media, in the media. Staying home is the most important prevention. If you must go out, make sure it's just for the necessities, food, medicine, and medical care. And also when you do go out, you want to stay 6 feet away from others. You want to avoid large crowds and small gatherings. And you always, always, always want to wear a cloth face covering so that you don't spread your germs when you talk, sneeze, or cough. An important thing to remember is that cloth face coverings should not be used on children under 2 years of age. Also on anyone who has any difficulty breathing, especially when their face is covered, or anyone who is unable to put on or take off a face covering on their own easily. Currently, there is no vaccine to protect against COVID-19, so really the best way to protect yourself is to avoid exposure. And how do we avoid it? You'll see it plenty of times written here. Stay home, okay? So I have a little diagram here for you. It's very easy to make your own bandana cloth face covering. I happen to have a nice little bandana here, courtesy of my husband. So you fold the bandana in half as you see on the diagram. Fold down the top and the bottom. So it's kind of like a little band across. And then you take either a hair tie or a rubber band, and just about 6 inches apart, you fold towards the middle and you just tuck in quickly. Unfortunately, I couldn't find my rubber bands, but as you can see, it's just about right to cover my mouth. And you have a little wiggle room to kind of spread it out so that it really covers your nose and your chin and fits snug, okay? Some people just simply tying it behind their back is fine. I happen to have a nice round face, so that doesn't always work for me. And also another key thing to remember is that your N95 respirators, which tend to look like this, the CDC requests that you please refrain from using these, because these are intended for hospital essential workers. And there's a shortage, as we all know. Please write to Congress to make sure that all frontline workers are provided with the proper PPE. There's a lot of fraud in trying to obtain PPE, which is why there is a great shortage as well. So just keep that in mind before you use a surgical mask or an N95 respirator. So everyday preventative actions: washing your hands often with soap and water for at least 20 seconds. If you must cough or sneeze, you want to cover your mouth with a tissue, throw the tissue away and wash your hands immediately, and always avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched object surfaces such as remote controls and doorknobs, and avoid close contact with people that you know are sick. If you are sick, you want to stay home and you want to call your doctor immediately if you develop fever, cough, or difficulty breathing. Those are the top 3 symptoms that you want to look out for when you do become sick. And this is the critical time to, if you don't have a doctor that you see regularly, that you choose a doctor that you can reach out to in the event that you do become ill. That's not always an option for us depending on the access that we have. But if you don't already have it, just plan ahead and try to find one that's convenient for you. Also remember to follow the directions of your local health officials. Different states, different cities are having different rules that you need to follow. So you want to make sure that whatever you're doing, all this information is straight from the CDC, but your local health officials are the ones who will be really the ones that you need to listen to in order to be safe when you go out. When you can practice social distancing by buying groceries and medicine and going to the doctor and doing your banking online as often as possible. This is not always financially feasible, as there are extra charges that may be incurred with groceries or charges for delivery fees, etc. But if you are able to do it, and then by all means, let that be your first option. If you must go in person, stay at least 6 feet away from others. Designate only one person to go so that there's not clusters of people together, and let that person do all the shopping for you. You can take turns if you live in a larger family, if you have a larger family and there are others who can assist. But usually just designating one person is the most ideal. You can get deliveries, takeout, just limit in-person contact as much as possible. A lot of the delivery services for food are offering the no contact option when they're dropping off your meals. And if you are sick, which unfortunately does happen, you want to stay home and only to get medical care should you be leaving your home, and you want to call the doctor before visiting because they may have certain protocols that they need to follow in order to best assist you. You want to avoid public transportation and ride sharing or taxis because you don't want to be in close contact or within close proximity to others and risk getting them sick. Separate yourself from other people and pets in your home. This is not always feasible as we tend to live in small and close environments. So if you share a bed with someone, you can sleep head to toe. And if you have small children who don't always understand, mommy's sick and you need to stay away from her, cover your mouth. That can be a bit of an adjustment for them to see you with your mouth covered, but this is the best protection for them. Also, you want to, again, cover your coughs and sneezes with a tissue, clean your hands right away. Have your hand sanitizer, if you have it available, right next to you, so that as soon as it happens, you can do it. But there's nothing better than just washing your hands with soap and water for 20 seconds. You want to also avoid sharing any items with other people in your home, such as towels and bedding. Be sure that all your dishes are washed in hot water before anyone else uses them. If you can at all dedicate dishes for one person, a cup, plates, knives and forks, etc. Do that if that is an option. And always stay aware of how you feel, because that is really what drives this. The only way that we can treat COVID as of right now is by treating the symptoms, and whatever symptom you may have, that's what's going to drive your doctor's plan of care. But as soon as you just start to develop difficulty breathing, or if you are worried about your health, you need to call your doctor immediately. We as Latinos tend to be a bit stoic and sometimes stubborn and say we're going to be okay, and if I drink lots of fluids then I'm going to be fine. But difficulty breathing is something that cannot be reversed easily. So it's really critical that you get emergency care if you come to that point. Again, no specific treatment for COVID-19, but you can seek medical care to help relieve your symptoms. So if you have a cough, they'll give you cough medicine. If you have a fever, you can take Tylenol or Advil, whatever works for you. And with the loss of smell and taste, you kind of just have to wait it out for that to come back. But difficulty breathing, you're going to need a more advanced level of care. So you want to contact your doctor, or if you must, head straight to the emergency room. But the emergency warning signs, just so you know, are trouble breathing, persistent pain or pressure in the chest, any confusion that is new, or if you are very difficult to wake up. Also, if you develop bluish tint to your lips or face. And when you call 911, if you need to, please let them know that you think you have COVID-19, or if you know that you have it, so that they're aware and they can take the proper precautions and put a face mask on before help arrives to protect them as well. As Veronica told us, our older adults are at higher risk for COVID-19, and those with serious underlying medical conditions. So these are the people that we need to protect the most. So these are the people that need to really stay home. So, and also, unfortunately, it's also important for them to stay away from small children. Again, this isn't always possible in our living situations. Sometimes grandma is the care provider for the child. So washing your hands and instilling that into your little ones from now is really the most important thing to do. Showing them, I mean, in schools, if they are in school, they're already teaching them, sneeze into your elbow, cover your mouth when you cough, etc. Wash your hands. And when are you washing your hands? Anytime you touch your face, anytime you use the bathroom, before you eat, if you're gonna prepare food, before you prepare food, after you prepare food. Look, I just touched my face. And I've been touching my keyboard, so bad Tanya. But just do the best that you can. As I said before, we don't always have the option of having a bathroom dedicated for a sick person. So if someone in your household is sick, you want to have the sick person clean up after themselves using disinfectants, household disinfectants, following the instructions of the disinfectant from the company. You want to have the area well ventilated, and just wipe down anything that the person has touched. If the person is coughing, obviously, and is unable to have their face covered, those germs can get out into the air. So you want to also wipe that down. If the person is unable to do it and someone else has to do it for them, that person should wait as long as possible to enter the bathroom after the sick person and wipe everything down, wearing a mask and disposable gloves, and then obviously washing their hands immediately after. And that's what I just went over here. Your phones and other electronics, follow the manufacturer's instructions for cleaning and disinfecting, but usually a 70% alcohol wipe is acceptable, and allow surfaces to dry thoroughly. If anything is visibly very dirty, you want to make sure you clean it with soap and water first, and then disinfect it with your household cleaners. And just lastly, hand sanitizer is very scarce out in our communities. They are starting to come back, but still a little bit pricey. You may be able to create this at home if you prefer. A lot of us have aloe vera that we use for sunburns in the summer. So if you have the aloe vera gel available in your home, by all means, or if you find it in the pharmacies, you can use that as well. And of course, if you have an aloe vera plant, what better resource. So you need isopropyl rubbing alcohol that is 99% alcohol volume. Anything in the 90s is acceptable. 2/3 cup of that, mix it with 1/3 cup of aloe vera. Add a few drops of essential oil of your liking, tea tree oil, lavender, eucalyptus, etc. If you don't have any essential oil, you can use lemon juice instead. And then you keep a 2-to-1 ratio of the alcohol to the aloe vera to assure that your alcohol content is kept around the 60%. You put it, you can put it in a spray bottle if that's what you prefer. A lot of people think it's easier just to spray and then rub. Or if you have an empty Purell bottle, which I'm sure a lot of us are running low, you can use that. And then it keeps for about 2 to 3 weeks. So make sure that you make small amounts at a time so that it's not keeping for too long. And that's pretty much it.
Wow, that was a lot of information.
Yeah.
Thank you, Tania. Those very helpful tips. Thank you for sharing. Wow, I was surprised, especially that one about those who do not have access to more than one bathroom. I think it's very important that, given that we know that is many Latinos, we share our homes with as many of us living in one house. So thank you. So we have Sandra Morales next. Sandra, you've been in the front lines and you have seen the pandemic firsthand. Please tell us about your experience and what we are facing.
Hi, how are you? Yes, what I do is I work at a local hospital on the Lower East Side. The population that I serve is mostly Latino and African American and Asian. What I have found, unfortunately, is that over a period of time when we were in the height of pandemic, it's very sad to say, but a large population of my patients, those that we took care of, were mostly Hispanic and elderly and very frail. Oftentimes, they would be admitted with dementia and other sorts of Alzheimer's. The saddest part of what I did in the work in caring for these patients is if they were early diagnosed, when they first came in and they were early diagnosed, if before we were quite sure that this was, COVID, the doctors were trying to rule out other upper respiratory problems, and they were ruling out for the flu, because many of the symptoms initially were very flu-like. And so as we moved into this pandemic and we started to recognize, many of the hospital members became sick because we were using the wrong attire to deal with this virus. So as the previous speaker spoke to you, this is a face mask here, which most people are buying in the street. And this face mask is called a surgical mask. And what it does is, if you sneeze into it, it will block the virus or any fluid coming out so that it will not impact you. But if you have a spray and you're working with a patient who is under a respirator and they have to suction him and do other procedures, that spray would go through that mask. And would impact and any other person. So this is the mask that was shown before, saving the lives of healthcare workers with our patients. So what we, once the CDC kind of figured out what we were doing and the regulation of care we provided, we put on this mask, are in a very desperate shortage for this N95 now. You saw the white one, this is a green one. There are different kinds of N95. This is the most common one, and it protects us while you are suctioning a patient and it's spraying in your face. You are to wear this kind of garb. What I did at the hospital was to be part of a surveillance team. And what we did was we made sure that we were active in trying to obtain PPE equipment, this is part of the personal protective gear. We had goggles that we had to wear along with that. And then we had to wear a face shield. And this is part of what some of the things that we had to do to care for our patients. The patients, unfortunately, then become isolated in a room on their own. Other members are not, and visitors were not allowed to come in. And the reason for that is because when visitors come in, they can either contract the virus. And if we're in a person was under investigation, not necessarily proven to have coronavirus, and they would have visitors, and this person had coronavirus, then they would spread it through the hospital setting. So our major role was to be able to care for these patients in a way that would be safe for them, and hopefully to get them through their process with a number of medications that are experimental, and many have heard what they were. I have to say that when we started this surge, we were at our hospitals, we had more than 2,000 COVID care patients, and every hand on deck was necessary. I have to say that because people have started to follow the social distancing recommendations from the CDC, and have started to put on face masks such as this, which is a cloth mask, okay? And make their own masks at home, and wear the surgical masks such as this one. And when they go outside, they have stayed home. That has now brought almost every one of our systems hospital. We went from 2,000 COVID care patients to the other day I came out in my last look at how many patients we have. We're down to 15 COVID positive patients under 50 under respirator care. And we have discharged more than 625 patients. That is an amazing, amazing improvement for where we were to where we are now. The saddest part of our war against COVID in our hospital setting was, unfortunately, many people died. Nurses are not used to having patients pass away unless there was some other chronic condition that brings them. But this COVID is a thief. It robs you immediately of everything. It robbed you of personal touch. It robbed you of a voice. It robs you of last will and testament, robs you of testimony, and it robs you of company. For healthcare workers, that was a tragic ending. It was what we did was we brought in tablets. Many brought cell phones so they can communicate with their family members, even though they couldn't touch them. Our members became anxious and had some issues, emotional, psychological, because they get very attached to the customers and patients that they're caring for, and they want to be connected with them. So what do? What we did was we created opportunities. We played music for our members. We played music for our patients. And part of my PPE team, as I train people to get dressed in their personal gear, one of the things that we did is that we put a smile on our face so that when we spoke to our patients, they always saw a smile on our face, and there was some ability for us to communicate behind the mask. There's always a heart, there's always a smile. We're happy to see that our patients are improving, that they're getting better, and they're going home. What we need from our community is to keep putting on those masks, to keep following the social distance guidelines, to keep protecting their family members, for themselves, for the community, and for us. And actually, we're looking up. We're starting to see these numbers go down. We're starting to send people home. We're starting to find treatment for this disease so that people can go home and be with their families. And that's what I have to share with you in regards to our time in the hospital. Thank you very much.
Thank you, Sandra. Thank you very much. Wow. Thank you for showing us the difference between mask and all that. I wish we had more time. So let me now transition to questions. And there is our members have been very active. There is a question there, Veronica, that I don't know if you have the answer, because I read the bill, the HEROES Act, but I have not got to that point. And it is, if within the HEROES Act, is there any help aid for nursing homes? That's the question we have. Veronica?
Oh, I'm talking and I'm on mute this entire time. Sorry. So
Yes.
what I noticed, I thank you for that question. And what I noticed about the question is that it says that it passed Congress, and it has not yet. Congress has not passed the HEROES Act. It passed in the House, but the Senate does have to vote on it as well. And so AARP is calling on Congress to help older Americans in that next relief package, especially nursing home residents and their families. So there is money in there for families. There is money that's in there. There's a lot of money in there proposed to help with economic relief in terms of food and the expansion of SNAP benefits and things like that. But AARP is urging and calling on Congress to pass that. It has not passed yet. So I just wanted to clarify that. And then also, I just wanted to take the opportunity to just mention that AARP filed an amicus brief with the Supreme Court to protect the Affordable Care Act as well. And there's a lot more information about what AARP is doing in terms of looking out for your health during coronavirus on aarp.org/coronavirus or aarp.org/el coronavirus in Spanish.
Thank you. That's important information to have. Then we have another question here. What can we do as advocate for workers? Well, let me say it. I mean, the HEROES Act is there and it has a lot of protections. It's a very good start. There are some gaps that we're not going to go into it, but for the most part, it covers a lot of the workers. It answers the questions of the workers and how to sustain working family at this point. And of course, LACLA and allies will continue to work and be vigilant that those provisions remain there and to fight for access for working families. But it is important, as we say at the beginning, to learn how we take steps to protect our family, especially the elders in our families. And this webinar was especially to talk about that, the steps that we can take, information that we can ourselves have in order to better be protective of those ones, las abuelitas y los abuelitos, not only those that stay at home, but also those that we have in nursing homes or in other places. So that's important. The other that we have, another question that we have is, how can chapters help, Veronica? How can chapters, LACLA chapters around the US can help and partner with AARP?
Thank you so much for that question. I'm always so excited to come to speak to LACLA members and their leadership, because I know that I can count on you to help and to get mobilized and get organized and get behind a cause. And so last year I had the privilege and honor of attending your national convention in Philadelphia. And I was able to speak to folks about the work that AARP is doing still to stop big pharma greed, right? So that advocacy around drug prices, and so many people signed the petitions and all of that. So what I would ask you all to do that you can help is go to aarp.org and take action on our website. If you have access to the web, which I hope you do since you're on this webinar, you can do it from your mobile phone as well. You can take action there. You can do it in English, you can do it in Spanish on our website, aarp.org, and you can write to Congress, write to them about these issues related to nursing homes, to protect nursing home residents and to protect their staff. That is really important. The other things that you can do now, since right now, we're not hosting in-person events, we're not doing anything that would put people at risk. So virtually, the way that you can help is by visiting our Facebook pages. So if advocacy is your thing AARP Advocates on Facebook. In Spanish, it's AARP Aliados Adelante. And then also on Twitter as well, on social media. You can also visit the Mi Comunidad page and see the different phone numbers that you can call. There are ways that we are mobilizing our volunteer base to help online, over the phone, and in writing, since that is what we are able to do right now at a distance. I have seen the question also specific to Central Florida. And just like last year, when I visited the National Convention, I was able to connect our state offices to you all, the chapter leaders in your specific state or in your specific community. I see a question about Central Florida. I'm wondering if you're in Orlando. If so, I have a specific person that I'll put you in touch with. But otherwise, you know, in your state, I encourage you to look up aarp.org, take action there. You can put in your zip code and it'll pull up, you know, your representative where you live. That person is representing you, whether or not you voted for them, right? So it's important to take action in writing and contact Congress. That's what we're asking people to do. And I'll make sure to follow up. I'll get connected to Carla to connect with Victor. I see your ask about Central Florida, so that I can connect you to our folks there.
Thank you, thank you. I know we're coming close. I mean, there's almost 7 something, and we do. So there is some questions about what else can LACLA do? And once again, LACLA will continue holding events like this one. We'll continue advocating virtually work that we have to do, as Veronica just said to us, working with our partners, but working also with Congress. I think the pass in working very hard to pass the HEROES Act is important. As I said, that covers a lot of what demands that we have, that covers as Latinos. But we need to continue bringing to life the needs of our community when we talk about Latinos, and also a more vulnerable part of our Latino community, undocumented workers. It is important to raise that plight. Most of them are frontline workers. They are just putting their selves, their lives, and their families in order to sustain what we have for those who can stay home. So it is important. LACLA will continue working with different other unions and with our chapters throughout that. I thank you for the partnership that we have with AARP. I thank you, my 2 sisters from New York, the work that you have done, especially in the front line for you, Sandra, going to work every day. And I know you're probably making a decision when you leave your family, and then when you come back, must be a tough one. And Tanya, once again, I mean, what can we say about nurses at this point? I mean, there's no words that we can find to say thank you, but also thank you for taking the time to share with us and with those who are with us tonight, the tips and the information that you gave us. I hope that we continue staying in touch, that we will continue working from wherever we are in order to once again respond, highlight the challenges that our community face. And we're lucky to have allies as AARP to work with us. As I said, having all that in Spanish, having that video in Spanish is so helpful. I mean, when we go and talk to Abuelita, no, we have the grandchildren translating, but that's a great step. I think one of the things that we ended up fighting in the HEROES, as it was language access, because it is, and I know AARP have done it for many years without having a law and act that demands it. So, I mean, let's continue doing that, brothers and sisters. If we don't have any more questions, let me see, there's another question that just came out. Thank you. First, they're saying thank you to all of us for being here, for the work that we're doing. I don't see any other question. So once again, thank you. Okay, there's a question that said, does AARP have a way to contact members of Congress?
Yes, so on our website or at aarp.org. So you can go to aarp.org. And when it comes to the nursing home piece, If you go to aarp.org/caregiving or aarp.org/cuidar, there's a little line on the subheading, and it refers to nursing homes. Click on that. And then to the right, you'll see a button that says take action. And that allows you to contact directly through that website. You can contact directly your congressman. And there as well, there are the phone numbers to call as well, if you prefer to do it over the phone. But my hope is that since we're on this webinar, folks are digitally savvy enough to go to our website and take action there on our website. You can also take a look at facebook.com/AARP advocates or facebook.com/AARP aliados adelante, aliados, ALIADOS. And that's our advocacy pages. There are always new ways to get involved, help us being shared there on Facebook. So thank you all. And I'll be sure to share those videos. Those videos are on Facebook. So if you want to share those videos in English or Spanish with your own networks, I'll be sure to share them with Carla, and she can get them to folks who want to share those with people they know who could use that information.
Thank you, Veronica. And we have just a couple of minutes, not much time, but Tanya and then Sandra, if you want to share, as I said, not more than a minute, we're running out of time here. So we'll start with Tanya, and then we'll go to Sandra, and then we're going to close. Tanya.
Sure. All the information that I shared with you is direct from the CDC government website. They have PSA information. So if you guys want to put together anything like videos and stuff like that, you can just literally read from a script. And they also have all the information that I gave in Spanish. They have printable posters that can be posted in communities and distributed if need be. But they have a really, really great resource for everyone. And I thank you again for inviting me and having me and allowing me to help in this small but hopefully impactful way. And if I will definitely share my slides, but the CDC website has everything in English, Spanish, and many other languages available. So anything that's on there, you can find on the website.
Gracias, compañera Sandra.
So I just want to say again, I have an elderly mother, which I say is the wind beneath my wings. She's 87 years old, and coming home from a hard day, I come to her house. I actually haven't been able to go to my own house since February. I've been coming to her home because home health aides were frightened by the COVID, and they were also being careful of bringing something to her. It's important that you remember that those people you love, cherish them, care for them, follow the regulations, do everything you can to take care of yourselves and take care of the health of your family members. My mother's 87 years old. She has Alzheimer's dementia, but she's still feisty. She's still acting. She's still an activist. She still likes to right wrongs. And I want to be able to continue to share with her for as long as I can all of those wonderful assets. I want to say in Spanish to all of you, que Dios me los bendiga, que le dé ustedes fortaleza, que nuestra comunidad se debe de mantener siempre unida y fuerte. Por favor, siga todas las recomendaciones que le dan a ustedes sobre el cuidado de sus parientes, sobre su cuidado. Por favor, sigan la distancia de por lo menos 6 pies. Si nos quiero ya ayudar a nosotros, a ayudarle a ustedes, los que estamos en los hospitales, la forma que más mínimamente nos puede ayudar es seguir esas regulaciones. Quédense en la casa si no necesitan salir, lávese en las manos y dale gracias a Dios por todos esos que están alrededor de ti, porque en verdad que es una bendición. Muchas gracias por haberme invitado y gracias por seguir haciendo lo que sigan haciendo ustedes para ayudar a nosotros a ayudarlos a ustedes. Buen día. Good night, everybody. Thank you.
Thank you, Sandra. Thank you. Thank you very much. I would like now to say thank you to all of you for joining tonight. I would also like to say thank you to our speakers for all your guidance and recommendation. And of course, I would like to say thank you to AARP for your partnership, always trying to work with that and working with LACLA. To our sisters, our sister from 1199 in New York for joining SEIU, for joining this effort. To our families, and especially to the oldest members, to keep them safe and healthy es important. A la abuelita, para el atole, para el café con leche, es importante. So, and also it's important for the well-being and the health of all of our communities. On behalf of LACLA and AARP, I thank you for being with us. Buenas noches.
Buenas noches. Thank you.
Buenas noches. Gracias.
Thank you. Bye-bye.